Good morning everybody, and thank you very much indeed for coming here today to celebrate our year of progress. You'll be hearing from some of our local leaders about the work being undertaken in hospitals and in communities and indeed in people's own homes across the whole region, and we'll be hearing from patients who can provide, of course, valuable insight for us all into the impact that the improvements are already making.
I think a lot has happened. I think a lot has happened in all sorts of different streams, whether it's the implementation of your local visions, but more importantly, I think the amount of energy that has been created in the system. And I think the challenge we have is how do we sustain that energy and how do we translate that tremendous amount of energy into what we're really aspiring to do.
The quicker we get the patient to specialist stroke care, the greater their chance of survival and the reduced risk of disability. Getting the care to the patient isn't necessarily about getting the patient into hospital.
We know that getting a diagnosis early and intervening early is really important in improving quality of care and improving outcomes and enabling people to live well for longer.
Patients First is our major change programme at the Royal Surrey County Hospital. It's designed to focus on what really matters to patients, that is having safe and clinically excellent care, having an experience with us that is compassionate, empathetic and respectful, and a service that allows them to get in easily to see us at a time that's convenient to them.
What's obvious, beside quality being the buzzword, I've heard quality needs to be systemic. We've heard about quality needs to be measured. I've heard quality needs to be improved. I've heard quality and cost are not separable. I just thought we should touch on one bit of quality, which is ultimately what brings us all to work. Quality is what the customer thinks. And let's, for the next 15 minutes, be the customer. In other words, be the patient. And I'm going to put the wristband to make David behave like a patient.
Yes, doctor. So innovation and all that goes with it should be something that's second nature to us, and that was a very important part of Ara's report. You're evangelical about this, and I'm really pleased that this process has been a huge success, and I'm grateful to Ara and David for that, but most of all, of course, we're all grateful to you for making this work. Thank you very much.